Aloha. This is a CME activity jointly provided by the Queens Medical Center and UH-Jepson Department of Geriatric Medicine. We offer free continuing education for this series, and in order to receive a CME or CMU or CEU, participants must complete the online evaluation at the end of the webinar. Your comments are very important to us and to the planning committee, and will be used to plan future programs. You can now check your CME credits online. Go to www.queens.org and type CME in the search tool. Click on My CME Transcripts, then sign in to generate your transcript. If you have any questions about accessing your CME, please email cme@queens.org. Yes. About Echo. We want to remind everyone that this is an Echo webinar, which means that this session serves as a forum for mutual teaching and learning from experts and from each of us on the front lines. As the Echo motto goes, all teach and all learn. So it will take all of you to create this community of learning. In the spirit of aloha, we encourage you to turn on your cameras to help build a community of learning. Feel free to eat in the Echo session. Good nutrition is the key to a healthy lifestyle, right? A little bit about our format. After a short lecture from our experts, we will share the experience from the rest of the team, then open up for case discussions. We invite you to share any geriatric cases. It may even be on a topic not related to today's lecture. We only ask that you keep it HIPAA compliant for discussion. That means that please do not share any patients' names, birthdays, and addresses, and so on. We learn best from our patients, and they are our best teachers. Our interdisciplinary team is here as well, and we will be willing to teach and share our collective wisdom with you. Most of you, or some of you, might know me. I'm Justin Legaspi, the program coordinator for the Geriatric Workforce Enhancement Program. And this little one is Siobhan Lana. She is 6 months old and our first baby. And we're very proud of her. Yeah. hmm She's saying hi to the rest of everyone. And now we have Maribel Tan, the president of the Foster Family Homes Association. Elsa Talavera, President and CEO of All Islands Case Management Corporation, Kiara McCoy, Health Coordinator Lead at Aloha Care, Layla Vintar, Health Coordinator Manager from United Healthcare, Healthcare, Kauai County, and Dr. Rita Bell Fernandez from the University of Hawaii. We are in the first month of our first month of our second part series on mobility. If you are interested in viewing any of those lectures and handouts, you can find them on our website. Unfortunately, we cannot offer certificates of attendance for videos you have viewed. You must participate in our education live. The title of today's webinar is Training the Brain, New Approaches in Brain Health. Now it gives me great pleasure to introduce our speaker, Amy. Amy Kelley. Amy is a certified brain health trainer, medical fitness specialist, and owner of Brain Matters, which provides education and brain health programs to empower the people of Hawaii to outsmart dementia. Amy also works with a multidisciplinary group of health professionals as part of the Hawaii Dementia Initiative's Brain Health and Risk Reduction Action Team, and is a frequent public speaker and workshop provider on the topics of brain health and dementia prevention. Amy previously worked as an environmental health scientist for 25 years, identifying health hazards and contaminant pathways in the environment and mitigating their impacts on human health. She received her business degree from the University of Washington and earned her master's in environmental health from Imperial College of London. Now, everyone, if you can please help me welcome Amy.
Thank you. Let me get my screen. Thank you, everyone. It's so nice to be here today to be able to present on this topic. And just a moment, having a little difficulty sharing screen. There we go. And all right. So thank you so much for the opportunity to speak to you today. And before we go any further, I really need to give a word of thanks and credit to Ryan Glatt at Pacific Neuroscience Institute. He really created the concept of the brain gym that I'll be discussing today, and also provided some of the background slides that I will be using. So let's start out with some brain health basics. This slide is probably going to be familiar to many of you. The worldwide population is aging, and with it, we are seeing an increase in the incidence and prevalence of Alzheimer's, or it's expected to increase. And here in Hawaii, we have one of the oldest populations in the United States. Also, one of the fastest aging populations. In fact, we are outpacing the rest of the US in that regard. By 2030, about 1 in 4 people in Hawaii will be 65 or older. And that is of consequence because the prevalence of neurodegenerative diseases like Alzheimer's doubles every 6 years from the age of 65. So preventing or delaying the onset of these diseases is of vital importance for the individuals, their families, the caregivers, our overburdened healthcare system, and assisted living and memory care centers. So how do we prevent or delay these diseases? That's what we're here to discuss today. Dementia is not a normal part of aging. And we know so much more about the brain than we did even 5 years ago. We now know that lifestyle is of vital importance for brain health, keeping it healthy and preventing these neurodegenerative diseases. And the Lancet actually published a study a year ago showing that lifestyle interventions, like the ones that we're discussing today, can actually reduce your risk for dementia by almost 50%. Now, ideally, you are doing these interventions throughout your life, but it's never too late to start. And lifestyle modifications can actually help delay the progression or halt the progression if you have already been diagnosed with mild cognitive impairment or even a mild case of dementia. So the key is get diagnosed early, but also try and start these lifestyle interventions well before you see any sort of sign of cognitive decline. And there are really a few pillars of brain health that we need to be looking at. First is maintaining and keeping our social connections, nurturing those social connections, managing stress in whatever form that works for you, whether that is meditation or deep breathing, maybe getting out and taking a walk in nature, whatever helps to downregulate your stress. Getting good restorative sleep every night, 7 to 8 hours, and going to bed and waking up at the same time each day. Eating real, whole, natural foods, less from a box, more from the earth. And the two that we're really going to focus on today, cognitive stimulation and staying active. These two things can really up the neuroplasticity of our brain, and we'll get into that in just a moment. But cognitive stimulation and staying active, when combined together, is called dual tasking, and that has a very synergistic effect on our brain's ability to change and adapt. Now, all of these provide the conditions for that healthy brain to be able to engage in this neuroplasticity. So the good news is that our brains can and do adapt and change throughout our lives. The less good news is that the older we get, the harder it is for our brains to do that. So that's why these lifestyle interventions are so important, to provide those conditions to enable that neuroplasticity. And neuroplasticity occurs in a few different forms. So many of us probably grew up with parents telling us, don't smoke, don't do drugs, don't drink alcohol, you'll kill your brain cells and you can't make new ones. Well, they were right about the risky substances really doing a number on your brain. Not good. However, fortunately, they were not correct in saying that we can't make new brain cells. We can in certain parts of the brain. We can also create new synapses, and those are the connections between brain cells. So let's say you're trying to learn Hawaiian and you're trying to learn those new words and phrases and struggling, but the more you struggle, that's where the magic happens, and that's where the brain starts to create those synapses so that you can recall the words later. And the more you work on that, the more those synapses will be strengthened. So you're able to recall the words faster and manipulate into sentences more easily. Now, on the other hand, that Spanish test that you studied for in the 8th grade and haven't used since, those synapses are going to be weakened and maybe go away entirely. And that's all right. The brain was not designed to remember everything. So that's part of that adaptation. We remember the things that we work on and we forget the things that we don't. But all of this learning and cognitive stimulation helps us build greater cognitive reserve. And cognitive reserve is kind of like your brain's fuel tank. We fill it up with our formal education early in life and any ongoing learning that we do throughout our lives, as well as other cognitively stimulating activities. And the higher we can get that fuel tank, the less likely we're going to see that low fuel warning light when we get older. And that is important because that is going to give us at least several more years of good cognitive health. The idea is that we are dying of something else entirely before we start seeing any real decrease in cognitive decline. And ideally, we should be getting about 30 minutes of cognitive stimulation every day. And that can include something that is new, novel to you. Your brain loves new, novel, stimulating things. So anything that is new to you is good for the brain. And of course, we need to be able to enjoy it. Otherwise, we're not going to continue doing it. And variety is very important. So I know people who do crossword puzzles every day and think that that's all they need to do. Well, they're not getting that stimulation that they got when they first started doing crossword puzzles. Your brain adapts and it isn't as cognitively stimulating. So ideally, you're really mixing it up. So if you are doing crossword puzzles every day, try Sudoku. And people will say, well, I hate numbers. Well, the things that we don't do are probably the things that we need to do. And so give it a try, just anything that's going to be different for you. And then socialize it. Have a game night with your family or neighbors. That brings in that social pillar as well. It also lends accountability so that you are more likely to keep doing it. And then when you're doing these things, make sure that it's not so easy that you could get an A+ on it. I tell people aim for a B because you don't want it to be so easy that it's not going to be stimulating enough. So you want to have a little difficulty in whatever you're doing. So let's add some exercise into this equation. And before we get there, I just want to mention that we're not talking about 1 or 2 randomized controlled trials showing that exercise is good for the brain. We now have thousands of trials. In fact, we have several meta-analyses, which are reviews of several trials showing, basically summarizing the results of many trials. But not only that, we have meta-analyses of those meta-analyses, or umbrella reviews. Basically, exercise is good for the brain, and research shows it. So this meta-analysis came out about 3 weeks ago in The Lancet. And this is a pretty busy slide because there are so many good effects of exercise on the brain. All of the alphabet soup that you see on the left-hand side of this chart is all of the neurochemicals, beneficial neurochemicals that are released when we exercise. They go through the blood-brain barrier, get released into the brain, and stimulate neurogenesis, the synaptic plasticity, so that the creation of those new synapses and the strengthening of synapses, angiogenesis, which is the creation of new blood vessels in the brain, and it stimulates learning and memory. I love the idea of the Dr. Wendy Suzuki at New York University. She calls this release of all of these neurochemicals in the brain a bubble bath for the brain. And I just think that's a wonderful, wonderful way to explain it. But the Lancet summarized their results by saying that there is strong evidence connecting exercise to improved cognitive outcomes and healthy brain aging, and it should be emphasized in public policies and incorporated into global physical activity guidelines. We've already talked about how exercise improves cognition, but it also preserves brain volume. When we age, our brains actually start to shrink. And the more they shrink, the more likely we're going to see cognitive decline. So we want big, fat, fluffy brains. Again, I'm taking that from Dr. Wendy Suzuki. She's my queen of brain analogies. Big, fat, fluffy brains rather than shriveled prunes. And our exercise also increases blood flow to the brain that the brain needs to survive and thrive. And there are 3 main types of exercise. You're familiar with your aerobic exercise and strength training. You may not be as familiar with neuromotor training. That is when we bring a motor skill together with a cognitive skill. So that can be divided into your mind-body exercises like your Tai Chi, your yoga, your Pilates. And then the other aspect is skill-based training. Think of your racket sports, your martial arts, surfing, dance, anything that you have to react to someone or something, and it's always varied and always changing. And that is also where your dual tasking comes in, combining the brain and the body. Different types of exercise impact different parts of the brain. So that's why it is so important to have an exercise program that is as varied as possible. It has as many different types of exercise as possible. So aerobic exercise has been found to impact the memory centers of the brain, such as the hippocampus. And the weight training impacts more of the frontal lobe, where our executive functioning takes place, things like planning and organizing, short-term memories. These are all very important to maintain as we get older. So try to have a varied exercise routine. But if you're not doing anything, start out with something and go from there. So let's talk about dual tasking versus multitasking. Multitasking is when we're trying to do two cognitive things at the same time. And your brain actually cannot do that. So what you're doing is attention switching. So you're trying to read and watch a television show at the same time. Your brain is actually going back and forth quickly between the two things, and you end up not really being able to do either one as well as if you'd just done one alone. Dual tasking, on the other hand, you're doing a cognitive skill along with a motor skill. And that has that synergistic effect of enhancing executive functioning in the brain. So you can see here some things that we do every day where we take advantage of dual tasking. In an exercise setting, I might have a client carrying two kettlebells, which is called a farmer's carry, and then asking them to recite the ABCs backwards, or maybe counting backward by 3s or 7s from a particular number. And then there's also called clinical dual tasking, where we are working very specifically on cognitive domains that we need to enhance, as well as physical functions. So let's say someone is having trouble with balance and memory. We would use a balance exercise together with an exergame that focuses on their memory. And we'll get into how that occurs in just a moment. But many benefits of dual tasking: improving cognition and blood flow, and all of the analyses that show that dual tasking actually has enhanced benefits for our executive functionings. Again, that planning and organizing and short-term memory. It also improves cognition more than single task exercise, and the benefits last longer and benefit our older adults, partly because it's more enjoyable, and when you enjoy something, you're more likely to adhere to it, and consistency is key. So let's find out how this is being implemented in the real world, and come with me to Gaithersburg, Maryland, which is about 30 minutes outside of Washington, D.C. This is Asbury Methodist Village, and this is an example of what you can do when you have the funding, the space, and the buy-in from all levels. They have an entire facility dedicated to health and fitness and brain health in particular. This is their group exercise area, and all of their group exercise classes include dual tasking. They also have a rock-steady boxing area if you were to turn around 180 degrees from this area, and that benefits their Parkinson's residents as well as anybody else who wants to join in that. If we were to go out that door and take a right, there is a climbing wall. Talk about empowering. I mean, they are not treating their residents with kid gloves and telling them they can't do anything. They are empowering them to live life and really make the most of it. Their Parkinson's patients take advantage of the climbing wall, as well as 80-year-olds. It's really amazing to watch. They also have very specific brain health programs, individualized, and these are the residents pay an additional fee to take advantage of these programs. So that is about $35 a month, and that gives you an initial cognitive assessment, and that helps them prepare a specific exercise program for them. They also enable outside residents to participate for a higher fee each month. But with these brain health programs, you are able to work on very specific cognitive domains. The woman in the wheelchair is working on something called a Smart Fit. And this particular game, she is working on attention and processing speed and visual processing as she tries to find and tap the two identical symbols as fast as she can. And the gentleman standing up is working on something called a DV.senso, and he's working on balance. So he's having to tap either front or back or left or right to uh, avoid different objects on the screen in front of him. So he's using balance, processing speed, and decision making to determine how he's going to avoid those objects. And all of these devices keep track of the results so that you can see how they are increasing over time. And they also make the games more difficult as the residents get better at them. Here's an example of a typical session structure. We can get into this more in the Q&A, but the main takeaway here is that it's 2 times a week for about 60 minutes for 12 weeks, and then a reassessment occurs. But let's come back to Oahu and come to Hale Kuike. Here, all of the residents are in memory care, and space is at a premium. So larger devices like the ones we just saw are not as easily able to fit here. And all of the residents' activities need to be conducted seated. So there's actually still a lot we can do here. And let's take an example. Here I'm working with the residents, and I've labeled each of their limbs with a number. So I've told them that their right arm is 1 and their left arm is number 2. Their right leg is 3 and their left leg is 4. So when I call out various numbers, they need to raise the appropriate limb. So let's 1 and 3. Excellent. Same side, 1 and 3. 4 and 2. Or same side again. Okay. I'm going to give you 3 numbers now. 1, 2, 3. Excellent. Okay, so actually, let me go back. So we can actually keep making that harder and harder as they get the hang of it. I can make the string of numbers longer. I can actually start giving them simple math problems. So 2 plus 2, and have them raise the answer to that math problem. And then on the left-hand side here, I'm using an app called Switched On. And in this particular game, it is blinking several different colors. And the person who has that particular color cone in front of them, they have to quickly take their free ball and switch it with the ball that is on that cone. So this is working on attention as well as processing speed. And then in the middle here, we've got a VR headset. So our memory care patients are not able to get out and get stimulated by the outdoor environment as much as we'd like. So we're bringing the outside to them. And here Myrtle is actually going on a hike in Alaska. We've also had the residents go swimming with dolphins, surfing, and going to a symphony at Red Rocks. We can also do exergaming with these VR headsets so that you are playing a game, using your body while also engaging that brain. And then on the right here, we have blaze pods, and they light up with different colors. Here we've got the 2 residents trying to hit out their particular color before the other does. So we're using gamification, we're using that nice sense of rivalry, and they just have a great time with that. So with that, let's go to questions.
Thank you, Amy. That was really great. I had a question regarding colors. Much like infants, does the brain react to color stimulation, like having certain colors on the wall, or maybe just introducing those types of colors in cups or forks, knives, things like that?
Yeah, I mean, visual stimulation is always something that's nice to introduce. And so that's why those apps like the Switched On, like the Blaze Pods, they're using color as visual stimuli. And so it does, give you a little more stimulation for the brain, especially when you're going at a faster pace.
Does anybody have any questions or experiences they want to share? I actually have one more question. Is there a point when maybe the dementia or the Alzheimer's is just too advanced, when maybe these interventions aren't going to work as well? And are there cues to kind of look at in members or residents that we take care of?
Yeah. So when the dementia is more advanced, name of the game there is quality of life and enjoyment. There is less we can do to stop the progression of the disease the further along it is. So this is why it's so important to get diagnosed early and so that we can create these interventions and really slow the progression. And to that end, I just want to give a shout out to, there's a woman who is right now on her 13th day walking across the United States from San Diego to Florida. She was diagnosed with Alzheimer's 13 years ago. And she took to heart these lifestyle interventions and slowed, if not stopped, the progression of the disease, so that she's able to walk across the United States, raising awareness for Alzheimer's research and how lifestyle can actually really positively impact this diagnosis.
Wow, that's incredible. With the dual tasking, I recently got like a walking pad while I work from home, and I've noticed that I've been a little bit more sharp in things that by the end of the day when I'm exhausted, I probably wouldn't have remembered, but I do kind of feel that like connection with my brain's actually, I'm getting better sleep, but like my brain is able to kind of cue on things that I probably wouldn't have remembered in the past since getting that walking pad.
And so there are there's much research showing the acute effects of exercise. So acute meaning short term. When we exercise, we feel sharper for up to 2 hours after that exercise bout. So if you know that you're going to be needing to engage in a very cognitively demanding activity, do some exercise beforehand, and you'll actually be sharper for that activity. But the more we exercise, the more chronic that benefit is. So while a short bout of exercise will give you that 2 hour kind of acute window, consistent exercise will give you that long-term more feeling of sharpness.
And when I worked more closely like in a nursing facility, we would do kind of passive range of motion for people who are, say, bedbound. Is that still something that could be significant for someone with dementia?
Yeah, I mean, you want to keep them as mobile as possible. And again, at that point, we're talking about quality of life. So we want to try and reduce pain as much as possible. Motion is lotion. So being able to mobilize those limbs and joints as much as possible is absolutely something to keep doing.
Great. Sorry, I'm going over my notes. I wrote down so much. With the strength training, which is better? Is it the neuromotor, or which exercise would you consider kind of the gold standard to kind of focus more on than the other two?
I wouldn't say focus on one more than the other. Focus on what you enjoy. Focus on what you're going to do. That's number one. And like I said, if you're not currently doing anything, find something that you enjoy and that you will do and do consistently. Now, the American College of Sports Medicine and the World Health Organization both recommend 150 minutes of moderate intensity exercise each week. Moderate intensity is getting your heart rate up enough that you can still talk, but you can't sing. And 150 minutes a week is kind of odd. Nobody thinks that in those terms. So that is roughly 25 minutes a day, or 30 minutes 5 times a week, or break it up however you want. But that's your minimum. Getting in, say, a 10-minute walk after each of your main meals. And that has the added benefit of helping with digestion and reducing those blood sugar spikes. So 10 minutes after each of your main meals, getting the heart rate up, and there's your 30 minutes a day. So, fit it in however you can.
And with your patients that you had in like the videos and everything, would you say that their dementia was kind of more progressed, or kind of where they are on the spectrum of their diagnosis?
Yeah, so we have I'd say we have some mild, but there are quite a few moderate to severe, and the severe are not participating as much. They might be in the periphery watching. They're not able to do as much, but if we can bring in music, and actually they do benefit from the VR headsets. That is something that has really been useful for all of them. And, we can tailor what they're seeing based on their past lives and their past experiences.
That's great. I never would have imagined VR being something that would have such an impact. And I can imagine seeing their faces, which I would love to do at some point in my life, to see that reaction. I hope they bring it. I'm on Kauai, so I hope they bring that technology here. I haven't seen it yet, but I would love to.
Well, you can actually get your own headset, which Holly Quike has done. So I got a MetaQuest to bring in, and then Marcus at Holly Quike bought a Pico headset. And we determined that the Pico was actually more comfortable for the residents, but they're using their own headsets. So you can get that on your own and start using it.
Yeah, I'm definitely gonna suggest it to some of my coworkers that are old coworkers that work at the facilities. That would be great. Does anybody else have any questions or shared experiences?
Yes, this is Norma. I have two things. One is like we have clients who's got like dementia, but at the same time, they are losing their eyesight too. So is there any more examples, or where can we get exercises for them? The one that you showed us is really nice, but where can we get more examples that we can, do it for them or exercise them?
I can send you some links to some examples, and you can use those as a jumping off point. And so I use those, and then I create my own exercises from that. You just kind of get ideas and then use your own creativity. So you're engaging your own brain there and creating your own dual tasking exercises. But I will send a link to, I guess, Justin and company, and they can send it out to everyone.
Okay, thank you. And this is a share, I'd like to share my experience. I'll be 69 this year. And 10 years ago, I was always interested with music. So I went to sign up for a piano class. And there were times that I get frustrated because when I go for my class, my teacher expected me that I have memorized my item. And then later on, she told me, you know what, playing piano is really good. You exercise your brain, your hand, and your feet. And then I realized, and I said, I kept on going. And later on, I really enjoyed it. So it's a good advice, to fellow caregivers who are, not young. Like, I'm not saying I'm old, but getting there.
I'm really glad you brought that up. Learning an instrument is so good for the brain at any age, and music also really benefits the brain. So keep
Yeah.
that up.
Thank you. Yeah, it's just learning a new language. So
Oh,
thank
wow,
you.
you're really going all out. You're doing amazing things for your brain.
I bought a donut-like toys at Amazon and have her blind patients collect them using a big stick.
Yeah, that sounds great. Yeah, anything that they're having to, use hand-eye coordination and maybe gamify it. See if you can make teams and have them compete against each other somehow. That always makes it fun too. I actually have the residents at Halekuiki, we engage in bocce ball. And I just bring regular tennis balls, and one team is the yellow team using regular tennis balls, and another team is using pink tennis balls, and they just love it. Again, the hand-eye coordination and that sense of competition.
I'm sorry, I just wanted to ask, did you by any chance have a video that you showed at the beginning that I might have missed?
I did not show a video at the beginning, just at the very end. Did you see that one?
Okay. No, I didn't. Missed it.
Okay.
I was just wondering, since there's time, if you could show it again.
Sure. Let me share my screen again. Just a moment.
Thank you. Appreciate it.
Okay, so again, I've labeled their arms and legs with different numbers. So their right leg is 1. Sorry, their right arm is 1, left arm is 2, right leg is 3, and left leg is 4. And here's what we're doing. 1 and 3. Excellent. Same side, 1 and 3. 4 and 2. Or same side again. Okay? I'm going to give you 3 numbers now. 1, 2, 3. Excellent. Okay, so we can also use letters. Label each limb with as A, B, C, D, and then go through a string of letters and have them raise them either at the same time or in succession. And we can, as I mentioned earlier, give them with the numbers simple math equations such as 1 + 1, so that they would need to raise the answer, which would be 2, their left arm. And we can also use shapes and animals and any number of things. I have a drill where we are, I'm asking them to raise their arms if I give them a food, and asking them to cross their chest if I give them a color. And so different movements corresponding with different things. And that actually makes me think as well, because I'm like, what food, so it's nice for me and fun for them.
Thank you.
Amy, this is Rita. I'm so impressed with the creativity and the way you have helped the patients at Halikuiki. That is amazing, your work in Hawaii. Our attendees today are from care homes and foster homes. A lot of their patients are not very mobile. So what could they do for, say, a bed-bound patient? Now, maybe they got patients who are in the bed. What kind of exercise do you have something that you have modified for a bed-bound patient, like a dual tasking? Can you share something easy that can be done in a care home or a foster home?
Sure. And again, it's going to depend on what they're able to do. So I would kind of take inventory of the movements that they can do, and then create things like I just mentioned. When I give you a color, you're going to do this movement, if that's something they're able to do. When I give you a number, or an even or an odd number, you're going to raise your right hand. Odd number, you'll raise your left hand, those sorts of things. Now, you can also use sounds, and there are a couple of free apps that you can download that have nature sounds and animal sounds, and so that's also wonderful stimulation for the brain. So when you hear a donkey, you're going to do X, and when you hear a cow, you're going to do Y, so ways to make it fun and stimulating.
That is so beautiful. I mean, I'm just blown away by the creativity and the things that you can do. This is fantastic. And thanks for sharing about the VR devices. They have an application for our senior citizens. I had no idea. Oh, that's amazing. Any care home operator or foster home operator wants to share what you do in your care home, what games you play? We're interested in fun games.
Me, I want to share my experience with my client.
Yes, please.
Yeah, because I admitted one of my client who got dementia. Then I learned from the family that he's not responsive anymore, even if they said goodbye or ask question, he's not responding anymore. So when I admitted him, I learned from the family that he enjoys watching The Price is Right. Then whenever I switch on the TV and let him watch The Price is Right, he's enjoying it, even though he has a very hard hearing. He cannot hear anything unless even if you put the hearing aid, there's still, he cannot hear it properly. But I can see his face that he's very happy while watching. Then I realize how much more if he can hear it, the more he will enjoy watching it. So what I did is I bought a headset together with a two-way. It's called, I bought a gadget which is two-way, wherein he can use the headset, and I can also hear simultaneously the speaker, so that, because sometimes if he's using headset, I cannot hear what the speaker is already on his headset. So we bought a two-way gadget wherein I can hear it, and at the same time he can hear it on his speaker. And he's really, especially if the wheel start to move, he's really shouting the numbers. Then I can see from that on, I can see the improvement. Then when the family comes to visit him, he can already give the names of the 4 kids, and he can even interrupt while his kids is talking in front of him. He will join, and the family is very happy that he said, "Oh, my dad is not like that before, but now I can see that he's very he can remember all the names of these kids and even the grandchildren. So I'm very happy. Yeah, every time the family visits him and appreciating what and I also bought him puzzles, the color, and he can identify color, but sometimes he doesn't want. It is okay, but once I observe that he's very alert, that's the time I will start to introduce that thing.
That's
Yeah. Oh.
wonderful. Yeah, and when we lose our hearing, that part of our brain isn't stimulated anymore, and it starts to atrophy. So, if the fact that you were bringing back his ability to hear is so important. And again, going back to that need to increase enjoyment and their quality of life by giving him something that he enjoyed previously. So, well done.
I think I don't mind just sharing something I used to do with my residents when I had them sitting at the dining table to do activities. I'd blow up a very colorful balloon, and so basically they would hit it like they were playing volleyball, and they would have to hit it to one another, and then I would ask them to hit it to a particular person so it would help with them stretching their arms out, and their eyes had to move, and then they had to figure out who to hit the balloon to. So that's something I kind of did, and it was fun for them.
Yes, and you can make it a little more cognitively challenging by telling them, okay, you have to hit it with one hand and maybe catch with another hand, or just you must hit it with your right hand. There are different ways that you can make it a little more fun and challenging.
Right.
Yeah, they
Oh,
love balloons.
thank you
Yeah.
for that. Yeah, thank you.
We had a couple people in the comments saying, doing the range of motion, playing music, watching TV. Naomi also said that hearing and visual loss can make people seem demented, even though they're not. And so awareness is key. So they were saying good work to Arlene for that great story.
Amy, I don't feel bad now when we get B grade and C grade. It may be a good thing that we didn't get A or A plus. It wasn't easy for our brain.
Absolutely right. Yeah, we need to make it a little difficult, and the things that we avoid are probably the things that we need to be doing. So always keep that in mind.
Oh, that's wonderful. Well, thank you, Amy. And I'm gonna ask John to share our evaluation piece. So we are now in, this echo is very practical. We want to give you practical knowledge, and this is based on the 4 M's of healthy aging. So we are in our mobility series. So the next 3 months, you're going to hear talks on exercise and different things to improve mobility. So we want to see for your residents, when you do the evaluation for the primary caregiver, if you could tell us how many residents you have in your care home or foster home, and then go by each resident. You can start resident one could be your first one who came to you the longest, who's been there for 5 years, 10 years, the longest one, and tell us, are they unsteady when standing or walking? Yes or no? Does the resident worry about falling down? Have they fallen in the past year? Yes or no? And then we want you to do one particular assessment called the tug. And I'm going to show you a video on how to do this tug. So you can say yes, no, or you've never done this, because some people are like, I don't know what you're talking about, Dr. Fernandez. We have not done this. So I want to go to the next screen and we'll show you a little video on how to do this tug. It is a national assessment, lot of research, very easy to do it. So let's watch this short
The
video.
timed up and go, or tug, tests functional mobility. To perform the test, you need a chair and a stopwatch, or a wristwatch with a second hand. Have your patient start by sitting on the chair, feet flat on the floor, one foot slightly in front of the other, and hands on the armrests of the chair. Put a line on the floor 10 feet or 3 meters away. Ask your patient to stand up from the chair and walk at her normal pace to the line on the floor when you say go. When she reaches the line, she should turn around, walk back to the chair, and sit down. Be sure to start timing on the signal go, and even if your patient has not started to move, and stop timing at the moment she sits back down in the chair. While she's walking, stand between the chair and the line in case the patient loses her balance and you need to assist. Observe and note the patient's posture, width of the base of support, step height, stride length, arm swing, and path. When the test is complete, record the time. Also record whether the patient used an assistive device, and if so, what type. A community-dwelling older adult who takes more than 12 seconds to complete the tug is at increased risk of falling.
So, questions about the tug. We are looking at whether they are 12 seconds or more. If it is more than 12 seconds, then they are at increased risk of falling. And you could say if you have a bed-bound patient and you cannot administer, then you can say not administered. So I understand that some of you may not be able to do it if your patient is completely bed-bound. So let's go with the questions about this. Anything about the mobility evaluation? So you're going to see different questions, and John can put the link in again, please, John, in the chat, if we could have the link one more time. Thank you very much. And we want to say to everybody, you will get your CME certificate. To get that, you got to fill the evaluation, okay? We do not give certificates if people watch the video later. They have to attend the session, and you will get certificate of attendance that will help you with your care home certification or your foster home certification for DHS or DOH. Lastly, we want to thank everyone for your service. Without the care homes, without the foster homes in Hawaii, I do not know what we would do. We absolutely do not have enough nursing homes in this state, and we thank you for your service, for your entrepreneurship to create these care homes and foster homes in Hawaii so people can live in a nice family setting. It is a work from the heart, and we really thank you for what you do. I would like to thank our speaker, Amy Kelley, who has given us such good ideas today. I just want to play games. That's what I want to do. Have a fun game. Thank you, Amy, for helping brain health and brain fitness. You taught us so much today, and we greatly appreciate having you.
Thank you so much. It was a pleasure being here.
Mahalo, everyone.
Thank you.
Thank you.
Thank you.
Thank you.